Welcome back to Body Beautiful. We'll be taking your live calls on the air. We have Dr. Joseph Mealy here. Sorry, I was slightly distracted. We were talking about hybrid cars. Now we're back to the subject of liposuction. Yes. You know, let's just go to the phone lines. I've got Angela on the line from San Francisco. Good morning, Angela.
Good morning.
You have a question for the doctor?
Yes, I do. I had lap band surgery about 6 years ago, and I've slowly gained the 70 pounds that I lost back. Now I'm considering either laser, fat removal, or liposuction. What the doctor should do?
Yeah, that's, you know, the lap band surgery is actually designed to lose weight. Liposuction is not designed to lose weight, and I think trying to remove 70 pounds with liposuction would not be advisable. It's just too much. Even if you're staging it, the problem is you may end up with some loose skin or areas that are irregular, where it may look better in clothing because it doesn't have the bulge, but out of clothing it may actually look worse. So for removing 70 pounds, that's probably too much. I would try to seek alternative ways to get that weight off first, and then try to tailor things up and make it look nice.
Thanks, Angela.
I know that's probably not the answer you want, but that's the best answer I have.
Well, it's unhealthy to take too much. I mean, I know that there's each person may be different.
Surgery is a form of injury, and you know we want to have some benefit to it. And the surgery for lap band is designed for weight loss. It's designed to limit the amount of calories that we can take in. Liposuction is not. So if she gained that much weight back after lap band surgery, she would gain that much weight back after liposuction. And I just don't feel like I'm helping folks if they end up back where they started.
So what is the maximum amount of weight that can safely be removed through liposuction?
There's a voluntary limit right now of 5 liters at a time, which is about 11 pounds. So that's about the most we remove at one sitting. There are some folks around who do larger volume liposuction. It's a different operation. I think it needs to be done under different settings. It's not the kind of thing that you have done and go home the same day. Usually you need to stay in the hospital and receive some additional care because there's higher chances of requiring blood transfusions, having problems with circulation in terms of the amount of fluid that we have in our bodies. It's a little more complicated to do that.
Okay, so Angela was talking about lap band surgery and liposuction. What about
with the lap band? You know, sometimes they're adjustable, and there may be a way to adjust the lap band to help her, and that might be a better alternative.
Can liposuction be combined with other procedures, such as, say, a tummy tuck?
Absolutely. And often when we're doing tummy tucks, we will do a little liposuction to enhance the results, to keep everything sort of so that it matches, so that the back and the front and the sides all go together. If someone has just a little bit of fullness in the back, it may not bother them if their belly's full, but once I get rid of that stuff in the front, it starts to bother them. So a lot of times we'll do a little liposuction at the same time to keep the proportions even.
Now, sometimes the skin is not always so elastic. After you remove some fat,
sure, it'll end up folding over or wrinkling.
Yeah.
And that's where tummy tucks are better for the belly than the liposuction. If someone has good, tight skin, I can sneak in there and unstuff it, and the shape will take the shape of what's left behind, which is the nice muscle shape underneath. If someone has a lot of loose skin and I do liposuction, I will deflate them further, and it may look worse. And that's why we do tummy tucks, to get rid of that extra skin and actually remove it.
So
if I had a skin shrinking ray, I wouldn't have to do tummy tucks. I
you
could
wouldn't
just
be
combine it with my liposuction.
talking to me here today.
Unfortunately, the skin shrinking rays we have right now don't make noticeable changes. I mean, you can prove with a tattoo that things have gotten smaller, but when you look, if you did, you know, one procedure on one side and the other on the other, you couldn't tell which side was which.
So can you tell going into it, when you look at a patient, how they're going to respond if they have elastic skin? Is it a function of age? Or
age does play a part, but really it's the elastic fiber that's in the skin and the collagen that's in the skin. As we age, our skin gets thinner and it becomes harder to shrink up. So yeah, younger folks tend to do better.
I mean, is that something that you counsel people about, that if they're going to take a significant amount out through liposuction, that...
Yeah, because if they have skin, I may advise them to either do nothing, to do liposuction that's not very aggressive to reduce the size but keep a nice smooth shape, or to do a different procedure that's actually going to tighten the skin.
Okay. I mean, after childbirth, the skin stretches out quite a bit.
Yes.
But fortunately, most of the time it comes back.
It comes back. If we could tap into that, that would make my life so much easier.
Okay, well, let's go back to the drawing board and research lab.
Smart people are looking at it,
Yeah.
but we haven't made a lot of progress there.
All right, we need to take a very quick break, Doctor. For more information about Dr. Mealy, you can call him at 925-943-6353 or check him out on the web at drmealy.com or at sanfranciscobreast.com. We'll continue talking with Dr. Mealy. Plus, we'll be taking more of your phone calls coming up on Body Beautiful.